Hi, it's Erik Cole back with the Design Studio for Community Solutions. And we're really thrilled today as we continue this virtual conversation series to be joined by Dr. David Coon, who is the Associate Dean for Research at the Edson College of Nursing and Health Innovation. He is a professor and he is with the Center for Innovation in Healthy and Resilient Aging. David, we're thrilled you could be with us today.
Well, thank you. I appreciate the opportunity to come and chat with you.
That's great. That's awesome. Well, we've told you about this series. We're just trying to have conversations with different folks in the ASU community that do work in a real community setting. So we'd love for you to tell us a little bit about your work and how you got started with it, if you would.
Sure. So most of my work is building psychoeducational skill building programs for older adults facing chronic illnesses. I've primarily worked in Alzheimer's disease and related dementias, some cancer, HIV over 50, late life depression, Parkinson's. And while I work with those older adults as well, a lot of my work is really focused on assisting in doing those psychoeducational skill building programs for their family caregivers, because they are the hidden patients. They are the patients behind the individuals facing those chronic illnesses. So we've worked over the years, my colleagues and me, to develop evidence-based programs, and we try to work with those with the community. So organizations like the Alzheimer's Association, local chapters, area agencies on aging, the Division of Aging and Adult Services at the state level, as well as in other states. Organizations like those and others that are serving seniors. We work not only in terms of in partnership with identifying people that might benefit from these programs, but we also work to train those organizations and staff that are interested in learning and being able to deliver those programs. I love working from the ground up. We often do focus groups in terms of trying to hear from the community what their needs are, and try to make sure that we integrate those into things that we know from our previous work and from the literature that are effective. And then we build these and then try to train individuals. Like I have a current NIH a grant where we've taken a program that's been piloted well for people in the early stages of dementia and their care partners. And we've trained the Alzheimer's Association to help deliver that and provide that. And then we do assessments. Because I am a researcher, I want to make sure that we're finding out what works and for whom. I tend to do this in diverse communities, so I'm very interested in serving a wide variety of folks. And while I primarily had programs that have targeted the Latino, African American or Black individuals and communities, non-Hispanic white, we have worked with other communities as well, including doing some work with lesbian, gay, transgender individuals in terms of their assistance for individuals that they're caring for as well.
Wow, that's fantastic. I think it's so interesting. I mean, it's critical from a community perspective that you're doing work with, not just the individuals that are facing some of these health issues, but also their caretakers, and providing, it sounds like also even a community space as well as some best practices and some skills for those caregivers.
Absolutely. I mean, that's part of the key goal. And we want folks with a variety of backgrounds to learn about and be able to understand some of the skills and strategies that they can impart those to their community. I have been a big supporter in terms of working with the Hope Promotores Network in Maricopa. And so, in fact, the co-founder of that is someone who's worked with me on my staff for a good number of years, Bertha Carvajal. And a good number of my staff are also members of the Hope Network. But we look at folks from that range from promotores and community health workers all the way across the gamut of individuals to people who are administrators, to people who are physicians and nurses and folks with a variety of training, because I believe it takes a team. And I believe that we really need to work actively to bridge the gap between what I think of as our healthcare system and our healthcare delivery system, and what I think of as our social support services community. Often that gap is the biggest. I used to think that providers and imparting information to older adults was the key gap. I then began to think it's actually not them, it's the information that needs to get to the family caregiver who's really going to be assisting the individual. But ultimately, I think it's not only those two, but it's also the individuals. There's this gap between what's provided in terms of basic health information to individuals that are facing chronic illness and family caregivers, but also what are the social services and social supports that are going to help those individuals. And so we really work with that, and part of what we do is provide that information as well. But we're really a skill building kind of a group. And in COVID, we are looking at how we can flip things to do more of these things via what we're doing right now, Erik. Right. Which has both pluses and minuses, and so we're working on those two to be able to flip evidence-based programs and see how we might serve people. So doing that as well.
It's one of those one of the things I talk about in our work as well, is like silo busting and kind of working across like these different divisions. If you're a community member living in a neighborhood and you have a pothole or something you want the city to fix, you don't care if it's the streets department or the highway department or whoever fixes it. You just want it fixed. And I think oftentimes with service delivery and health and those separations that we see, they're very apparent to you and me and to those of us that work in the space. But from a person's perspective, having that, whether it's a promotora or having that ability to bring those, kind of thread those things together, I think is really important. So that's really excellent. Well, you talked a lot about kind of how you all engage a diverse set of communities. Tell me a little more about kind of the strategies that you all use. I mean, I know language is very important, cultural appropriateness. Tell us a little more about that, how you all go in and engage.
Right. Well, I think that I do kind of a combination of community participatory research as well as direct kind of offering for feedback. So I am pretty adamant that sometimes when I'm working with folks that come from a very staunch community participatory research, they talk about starting at the very beginning. I actually think that can do a disservice for a community. If we know some things that have worked with a variety of communities, what we try to do is with focus groups and focused interviews and key informants, we may ask what they would like to see, what they would like to think have worked, what strategies have worked, what hasn't worked. But then we typically go ahead and offer up and say, well, here are some things that have worked in a variety of communities. How do you think that might resonate with your community, with your family, with your loved one who's facing this chronic illness? Because let's be honest, I mean, we know that behavior change is hard. If behavior change wasn't hard, we wouldn't eat too much, drink too much, smoke too much, swear too much, do all the kinds of things that we think we probably shouldn't do. Right. But at the same time, most people don't walk in and say, I want behavior change components. I want, they don't know exactly. And so we have to be very careful. I in no way want to take something and impose it onto a community. But what we do is, as I said, we typically have tried to build things from the ground up and check back and forth into the community, and then through a series of focus groups, et cetera. So I think of it as an iterative process. Yeah. Always when people are participating, while we do look at key outcomes and try to get feedback about key outcomes, we also are asking them for feedback about how they thought they benefited from what was offered. And that's different than whether I liked it, okay? Because let's be honest, sometimes the things that are good for us, we may not like, but we may benefit from. And so I get a little tired of people wanting to make everything, you know, the kumbaya of today, you know, where we sit around and sing and eat marshmallows around the campfire. Not that there's anything wrong with that per se, but that's not all there is. And so how do we do this? And then we also have to own that we can't be all things to all people. And what I mean that is not a group of people, but sometimes we get lost in the heterogeneity of what may even exist in a family. When you think about your family, when you think about your friends, y'all don't like the same things, okay? And so we offer a bit of a multi-component approach with the hopes, because we know that these problems that people face are often multifaceted. So can the different strategies that we offer help people, and can different people resonate with different ones or different combinations of them? And, you know, and I'm happy to talk a little bit more about what some of those kinds of things look like that we do as examples. But again, we offer things in Spanish and English right now. I don't offer them in other languages. I don't have the bandwidth or the funding to do that yet. Although some of my colleagues and me, we have seen that happen in Chinese, and Japanese, and Farsi, for example. So, but my work right now really is offered in English and Spanish.
Gotcha. That makes sense. That makes sense. So, I mean, you talked about, we've done all this switch to distance communication and distance learning, and, you know, trying to fit everything into this little box called Zoom. What other, I mean, impacts, or what other pivots have you all had to make because of the COVID situation?
Well, I think that there's several. I mean, we're still in process of trying to figure out how this is going to work, because there is the reality, I think, of Zoom brain, Zoom fatigue. How do you engage people? So we're looking at how we package these a little bit differently. Because we're teaching skills, because I believe that so many family caregivers and older adults facing things like dementia feel isolated. We want to try to bring groups together, and then what we often have is not all of our programs, but a good number of them have kind of one-on-one coaching sessions where you take the skills that you apply, that you learn in a group meeting, and then apply them to your specific situation. Because we want to teach people methods, because across the course of a chronic illness, things shift and change. And if you learn how to understand some aspect of behavior change, how to change what you do and how you think, if you can learn a strategy that gets applied across different situations, and can adapt that, then it's going to have more legs. And you're going to be able to apply it across situations. So back to the issue of what we've tried to adapt to, there are some things that are still on hold. I mean, you know, I have a face-to-face, what we call randomized clinical trial right now that's on hold. And because we are keeping people safe, human subjects research is very specialized only, can move forward at this point right now. And we want to be safe. We want to do that. But we have really had to adjust our staff in some ways in terms of, you know, strategies and things that they're doing, shifting work from a lot of the direct kind of intervention, education kinds of things to this. So their mode of delivery, how they work is quite a bit different. How we're doing outreach is quite a bit different. We are active. I spend a lot of time out in the community, as does my staff, presenting. And right now, so many of those larger venue presentations have been shut down, or postponed. Some have been completely shut down for the year. Others, they're hoping maybe something will open. So our research strategy is beginning to think how we do things online, how we do things via social media, how we do them in different ways, have had to emerge. It's we are part of what we're doing, and it's interesting because we started to look through a nice gift, anonymous gift from an individual to see how we could take our programs and flip them and make them more accessible for working caregivers, for caregivers who are in rural areas and a bit disjointed, for people who are trapped in their homes due to their own functional impairment, or maybe because of economic strain. So we were already sort of working in this larger umbrella of social isolation, but we've been running a good deal of focus groups, both for that as well as something we call caregiver conversations, to understand how are people coping, what strategies that they're using, and to help us think about how we're flipping things. And we're moving a number of things we do for professionals and promotores and community health workers online to try to figure out how we reduce the length of time, because when you may be getting a sense, I like to work a room. I don't usually stand behind a lectern. It's not my modus operandi. I know that's probably shocking for you at this point. But you know, we're trying to figure out with our staff, how do we do this, break it up, make it interactive, but also keep people engaged. And then also, how do we do the evaluation? Because part of this is that, you know, we need to evaluate things, and I must admit, it's a lot easier to just click when you're done and exit rather than fill the you know, as opposed to when I'm standing there saying, please fill out the evaluations. They're all anonymous, and we would love to. You know, some of them are anonymous and some are not. But you know, we're trying to figure out how to do that, because people do provide us with funding to help us also evaluate what we're doing.
Right. Right. I mean, even just even just the action though of reaching out, of doing the support. I mean, you know, I can just see in terms of isolation, like, you know, we gotta have this. Your research, your work is so important, so that we know, you know, if this goes on for a much longer time, et cetera, we have other strategies to reach people that are isolated as well. That's a piece of it.
And it's a little nerve-wracking, quite honestly, because and nerve-wracking is probably too strong, but it's you know, with somebody that's worked with family members, family caregivers, and older adults for, gosh, you know, well over 30 years. You know how stressful this situation can be, and so when they're feeling that they have to stay in their home, when they're feeling isolated anyway, then to add this other layer that kind of people handle in different ways, but there are real concerns. Do I have people come by? How do I stay connected? And do I have the interest, the skills, the equipment, the internet access to be able to do things? So we've had to do some things via telephone solely. And while this is wonderful, you know, I'm babbling on, and you're probably, you know, if we were sitting face to face, I might be catching up a little bit of clues that he's like, okay, enough of that, let's move on. So, you know, and when you're on the phone, and we're running a focus group solely on the phone because I'm working with people in rural areas, it's challenging, but it's better than nothing.
That's right.
And one thing that I am committed to, and have always been, is to hear the voices of these people. So whoever they are, and you know, wherever they're coming from, and hearing that they're going to be different voices, and not everybody is not everything's going to resonate, and how do we have referrals for things that don't really fall within the purview of what we do.
Man, this is really great. I really appreciate it, because there's so many alignments, I think, in terms of the philosophy and just the practice we do. The other thing, just a little thing on the digital question, we found with our, you know, that we were with two of the elementary school districts in Maryville, right? The Isaac and the Cartwright district. And we've been talking to the Isaac folks about helping, you know, trying to figure out ways to get their families a better set of internet plans. And the issue is not the issue. One of the issues is, yes, there are these cheap plans out there, and there's some options, but they drop to half speed halfway through the month, and they can't run this, right? They couldn't run the Zoom, right? And a lot of these curricular platforms now for kids are higher, you know, they run a lot of video, right? They run a lot of audio. So
very challenging.
Yeah, yeah. So anyway, it's another connectivity. It's a deeper level issue. Okay, I don't want to keep you too long. I do want to ask, like, how can community members find out about what you do and connect with you all? I know you also have, I think you have some studies active right now. We want to help get that word out. So
Yeah, we have multiple things going on. We are aging successfully in diverse communities. You can find us on Facebook with regards to that. But also, I can rattle off some numbers if you want those.
yeah,
And so we have uh, a 1-800 number that is primarily for English speakers, and then we have one for Spanish. So the 1-800 number in Spanish is 1-833-993-1723. So that's 833-993-1723. And then we have one for English speakers, 844-418-5538. So it's 844-418-5538. And we do have two separate lines just because sometimes they fill up. And so we want to make sure that, and we really do want to encourage people to leave a number in COVID and at a time to try to reach you. In the reality of COVID, we can't have people sitting at the phones all the time. And,
right.
That's just our reality right now.
Yep.
And so we do our very best to get back with you within 24 or so hours. We are not an emergency line. We don't have the capacity to be that emergency line, but we'll do our best to tell you more about this. And then if you connect via Facebook, you'll see other ways, maybe in terms of an email address to do, etc. But I would suggest those things.
That's great.
With. Okay.
I'll see if I can. This thing will do a transcript for me so I can get the numbers from it, and then I'll see if I can figure out a way to like superimpose the numbers on the video. That would be like
that would be great.
Upper echelon for my technology skills.
The last thing I might say is that we're also connected through the Arizona Alzheimer's Consortium, which is a consortium of 7 main institutions, including organizations like Banner Alzheimer's Institute, Banner Sun Health Research Institute, Mayo Clinic, Barrow Neurological Institute, TGen, U of A, ASU. And I guess I would just really encourage people also to go to our Facebook page and connect if they have any interest in volunteering. It's a little bit more commitment once a year, but particularly in terms of the underserved Latino and Native American communities, we need to hear the voices of those folks in the fight against Alzheimer's disease. And while our team doesn't do the assessments there, they can talk with folks at our number about what those assessments are like and provide that bridge, because we so desperately need to have folks, and this can be healthy volunteers age 50 and over. If there are people that have concerns about memory, they can also be connected there as well, and some information can be provided. But while that's not directly my own work as much as the others, we work very closely with them and we're connected with them. They've been gracious enough to help fund some of our team members to do outreach into the Latino community. And I just wanted to mention that as well.
That's fantastic. No, that's great, because I think that's the other thing we're always trying to do is plug in research, volunteer opportunities and engagement, because you're so right. I mean, we can't know how to solve or to understand problems unless we listen first and really engage these different voices and give them the space, have the space for people to share their voices. Okay, last question, promise, and that's just for you, kind of as we've all dealt with this the pandemic and changes, what is the one piece of advice you'd give to people? How do you cope with all of this?
I think you have to really think what helps you that's healthy feel better. So if it's walking, if it's Zooming with a friend, if it's no, I'm Zoomed out, it's chatting with a friend. If what is it that helps you feel connected to the core of who you are? and in the midst of everything, and some people would say that that's work. Well, if work, you know, and I can relate to that, okay? I probably picked up on that. But also, what can you do that really helps you de-stress, connect with yourself? And if that's, sometimes we spend the day with people on Zoom and we need to go home and hold our cat, okay? And other people are isolated and they need to reach out. Other people need to feel more connected to their body. So what is it in the sense around the wellness wheel that works for you? And, you know, the things that were just mentioned, those are all things that I do because I need them at different times and different times through the week. I can tell you, by Friday night, I want to go home and hold my cat. Every day I do walking, you know, and some days I have Zoom fatigue. So there you go. All right.
That's great. Well, we really appreciate your time. And
well, thank you for asking about us. And if you want us to come back at some point, we're happy to do that as well. So
that'd be great. And you know, eventually we'll be able to go to some of the same meetings together back in the community.
That would be great.
Wouldn't that be nice?
That would be excellent. All right. Take care now.
Thank you. Bye-bye.
Bye now.